Only 3 years ago, my friends and family watched as I took physical steps up a stage and metaphorical steps into a new chapter when I graduated from the University of Washington, not knowing it would be one of the last in-person events I would attend for years after. Shortly after that, before masking on flights was required, I earned a fellowship to travel abroad. And when I landed in Johannesburg, South Africa, the first destination on my over 5-month journey, I had no idea that this trip would be the catalyst for the work that would land me here on the TEDxYouth at Seattle stage. I noticed something really quickly, and if you've been to South Africa, you might know what I'm going to say. There's a massive disparity in resources. Neighborhoods with big houses, gates, paved roads, and sidewalks sit only a few blocks from large communities of people living in houses made of tin with dirt floors, an injustice which echoes from the calculated oppression of apartheid. Box trucks filled with workers would make their daily commutes miles outside of those townships, which had little in the way of job opportunities. And most evenings, dozens of Black domestic workers walk miles to the nearest bus station after a full day's work in the white neighborhoods to go back to those tin houses. This is an overt disparity, and importantly, it was constructed to be this way. But beyond the physical difference in resources, I had yet to learn about the impacts that this had on the health of each community. As you might have guessed, I'm fascinated by public health, and that's why I decided to make it the focus of my trip. I spent months reaching out to clinics and laboratories, including the Fred Hutch HIV Vaccine Trials Network Lab in Cape Town and the CISPOC Health Training Center in Mozambique, trying to get a sense of how hurdles to health varied from country to country. In visiting local clinics and labs, I learned that chronic infectious diseases such as HIV and TB spread much easier in the Black townships because of the lack of access to space and community resources. Not only were the physical resources disparate, but the health outcomes of the residents were far worse. According to an article published in Globalization in Health in 2021, not only is the prevalence of TB tied to factors such as poor shelter, economic inequality, and the migrant labor system in South Africa, but the budgetary allocations to address these issues leaves much to be desired. My fellowship travels would take me to Mozambique, Namibia, Ghana, and Brazil over the next 5 months, with the COVID-19 pandemic forcing an end to my trip in March of 2020. So suddenly, I'm not catching taxis to the Ministry of Health building or standing in crowded waiting rooms in public hospitals. No, I'm flying home to a pandemic. And now I'm part of the case study. During my time in quarantine, I started to reflect on what I'd learned. I basically had a now what moment like we all did. And I started to wonder how I could use my own background in science to promote health equity in communities right here in the US. I'm a third-year biology PhD student studying how cell signaling can lead to the spread of tumors in breast cancer. I've been interested in biology for as long as I can remember. I'm fascinated by how our genes are regulated, the fine-tuned feedback loops, how thousands of proteins come together to make us. Studying biology helped me to see how truly complex we are. And my situation has been really unique because not only am I one of the youngest PhD students in my cohort, I've also frequently been one of only a few students of color throughout my entire scientific journey. Even as a biology student, I've always understood the power and importance of public health and health equity, and I view science as a tool to improve the quality of life of underserved community members. Although it's taken time to find a way to have an interdisciplinary impact, now I work inside and outside of the laboratory to improve health outcomes in communities. With the calls to action following the murders of George Floyd and many others, the nation begins reckoning with its systems of oppression. So I'm basically glued to the news, glued to social media, having hard conversations, trying to educate myself on topics I felt I should have known more about. And frequently, I'm finding the conversation goes well beyond police brutality into less discussed forms of oppression. that still have a massive impact on communities of color. And I want to share what I'm learning. So I called my friend Jordan, who I've known since the 5th grade, and we begin to talk about our role in the scientific community as Black scientists. There's a long history of using science as a means to dehumanize, marginalize, and to restrict people of color, and to ultimately justify discrimination based on fabricated biological differences. And these practices have had a long-lasting impact, affecting the representation of people of color in science, and decisions about what we research and how we use cutting-edge technologies, decisions which are largely made by white scientists. So we knew we wanted to change that. We wanted to encourage folks who haven't been traditionally represented in science to see how possible it is for them to be in these spaces. And I told Jordan about my trip, how I witnessed firsthand how the environment in which one lives can have a direct impact on their health outcomes. And that just like in South Africa's townships, community resources in the US are the key to preventing chronic disease and illness from occurring in the first place. And it was a great and passionate discussion, but we had no idea what we could do with that. How could we even begin to tackle these issues of policy, biology, community health, community structure, environmental health? I only study one of those, and that isn't even the full list of problems. So we did what all stuck scientists do. We started reading. We started a journal club. And we found decades and decades of research and examples of environmental injustices and environmental racism, topics I just wasn't familiar with. But we read about how discriminatory policies have led to targeted pollution, about farm workers and their families being exposed to pesticides at alarming rates, about Hazel Johnson describing the toxic donut of factories that surround Black communities in Chicago and organizing to raise awareness, about protesters in Warren County being arrested by the hundreds because they refused to allow toxic soils to be dumped in their community, about petrochemical factories creating a cancer alley in Louisiana and posing a serious health risk to thousands to this day. Marginalized communities bear a health burden, which is the byproduct of our way of life. We spoke about how the most affected can begin to access science to improve our communities and everyone's health. And we knew we had to do something because the effects of lacking community structure are taking a hold in our city, our state, our nation, and leading to high rates of chronic disease. Asthma is highly tied to the discriminatory practice of redlining, which makes biased factory siting easier and impacts the Black community at alarming rates. There you see redline neighborhoods have high rates of asthma hospitalizations. And beyond it being an issue in and of itself, it becomes an underlying health issue, a risk factor like obesity or high blood pressure affecting the susceptibility to other diseases. The most recent and devastating example is that of the COVID-19 pandemic, in which Black community members died from the disease at 2 times the rate, and were hospitalized at 3 times the rate of their white counterparts, according to data from the CDC website. And after our conversations, and after our journal club, we learned that the communities that are the most impacted by issues of pollution, chronic disease, food insecurity, and which have been the most susceptible to the COVID-19 pandemic are the least represented in our research, our classrooms, and the overall conversation pertaining to community health. So, taken together, we need to employ community-led solutions and break down the barriers which have prevented us from problem solving together. We can't improve the health of soils in marginalized communities or decrease food insecurity in these communities or treat the air in places where pollutant emitters surround communities without those communities. That's like getting the Olympic curling team to run the 200-meter dash. It doesn't make any sense. To promote equitable access to resources in communities of color, in May of 2020, Jordan and I co-founded an action-oriented, education-focused community organization. We educate on issues of environmental justice and hold mobile community workshops to encourage folks in our community to take action. We work in neighborhoods like the historically redlined Central District in Seattle, where we're working with the folks at Seattle Parks and Recreation to restore raised farming beds in a community garden there, turn them into a community asset, and increase the access to healthy foods in the area. Action-based education and science is changing the health of this community today, and through working hand in hand with the residents, we're proposing solutions for a healthier tomorrow. We also work with organizations that are interested in learning about concepts of environmental justice and how to take steps toward action. We work with farming groups, food distributors, educational organizations, youth groups, and governmental partners, and many more amazing organizations. We've had so much support in this space over the last 2 years, and we've grown so much as a result. Community-led science is also important to promote for our future scientists, students in their early stages of their middle school and high school careers. I wasn't aware of the ways in which my community impacted my health when I was in high school, and maybe you weren't either, but what if students sitting in their classrooms could learn this today? We support teachers with materials that make it easier to put solution-based learning in their lesson plans. It's been especially helpful for teachers that have had difficulty incorporating steps toward action or concepts of environmental justice in their curriculum. And I understand that difficulty because I had to bridge the gap between community action and science for myself as a growing scientist. But we learn so much about ourselves when we contextualize the issues that we face. It's one thing to learn or teach about soil health and ecosystems and plant biology, but it's another to understand why access to healthy soils is important, how policy has determined who has access to healthy soil, how pollutants in soil can affect an individual's health, and whose health has been affected as a result. And most importantly, we work towards solutions that we can put into practice to change our world. I'm still amazed when I hear teachers ask for us by name to present at workshops, or when students share about their own communities and say that we inspired them to take steps toward change locally. Jordan and I and the rest of our amazing team, which is growing all the time, are still finding new ways to be a part of the solution. But taking action through science is more important now than ever, especially with the recent undermining of the EPA by the Supreme Court. I don't get deep into political debates, but when community health and science are impacted, I pay attention. Communities that face the effects of climate change first due to socioeconomic status bear the brunt of our changing climate today and have the fewest resources to create changes for tomorrow. I encourage you and your family to talk about what health looks like for you and to learn about your own community. You can use an environmental mapper to learn about the resources in your area, learn about the hazards, and to connect to community organizations that are using innovative solutions to combat health disparities. Systemic inequality isn't on the other side of the world. It's right here. I didn't have to go to South Africa or Mozambique to get this. We have tools at our disposal to improve our neighborhoods tangibly, and each of us have the key to connecting those tools to those that need them the most. By using science together, we can bring about a forward-thinking and equitable future that everyone can access. So start your own journal club and take steps to create physical change. Thank you.